Hi everyone, my name is Samantha Bray, and I'm going to be talking about traumatic brain injuries. Traumatic brain injury starts on page 524 of our DSM-5 textbook, and I'm going to start with the criteria. So, for criteria A, it states that is met for major or mild neurocognitive disorder. So, back when this chapter starts, it talks about what a major or mild neurocognitive disorder is. So, you would have to meet that criteria in order to meet the criteria of a traumatic brain injury as well. So for criteria B, there would be evidence of a traumatic brain injury. And a traumatic brain injury is an impact to the head or other mechanisms of rapid movement or displacement of the brain within the skull. So this is, when your brain is kind of jostled inside of your head. And uh, this can show up as a loss of consciousness. You may pass out or slip into a coma. It could also be post-traumatic amnesia. You may not realize what happened to you, or it may just be completely blacked out of your memory. It could also be disorientation and confusion, which kind of, explains itself. You may be confused, not really know what's going on. You may have some anger because of your confusion. And you may also show some neurological signs. These neurological signs could be an onset of seizures that you've never had or worsening of pre existing seizures. It could also be visual field cuts. So your vision may change a little bit. You may have black spots that you never really had before. And you can also experience amnesia, which would be difficulty sleeping. So for criteria C, the neurocognitive disorder presents immediately after the occurrence of a TBI or recovery of consciousness. This means, these symptoms won't show up a couple days, a couple weeks, a couple months later. They'll show up immediately, whether it's directly after the traumatic brain injury or as soon as you wake up from consciousness. So these are some specifiers of a traumatic brain injury. And now this goes back to criteria B that I just talked about. So for loss of consciousness, if you experience a mild TBI, you may have about 30 minutes or less of unconsciousness. For moderate, it would be 30 minutes to 24 hours. And for severe, it may be greater than 24 hours. For post-traumatic amnesia, for a mild TBI, you may experience less than 24 hours. Moderate TBI would be 24 to 7 days. And for severe TBI, it would be greater than 7 days. So for disorientation and confusion, it's actually based off the Glasgow Coma Scale, which is a series of tests that they perform on you while you're either in a coma or unconscious, and you want to score very high on these tests. So for a mild TBI, you may receive a score of 13 to 15. For moderate TBI, you will receive a score between 9 and 12. And for a severe TBI, you'll receive a score between 3 and 8. So the severity of a TBI does not necessarily correspond with the severity of a neurocognitive disorder. This means that if you have a mild traumatic brain injury, you still could have a major neurocognitive disorder. This goes off a lot of variables, which also correlate with the recovery of a traumatic brain injury. So these variables could be the injury itself, your age. Now, if you're between the ages of over 65 or under 4 years old, traumatic brain injuries are usually a little bit more severe. If you have prior history of brain damage and substance abuse, these could worsen your traumatic brain injury as well as your neurocognitive disorder. Now, all these factors can either help or hurt your recovery time. It really just kind of depends on what you have on your side, basically. Typically, for a mild traumatic brain injury, it can take a few weeks, maybe a month or two to recover. While if you have a moderate or severe traumatic brain injury, it can take much longer with much more severe deficits. Now, these severe deficits are what we talked about again in criteria B, new seizures that you haven't previously had, or worsening seizures, visual field cuts, blind spots, or amnesia, which would be trouble sleeping. So now, major or mild neurocognitive disorder can have a lot of associated features. That is, due to a TBI, and these features can include disturbances in emotional functioning, which could be irritability. You become easily frustrated. You have higher levels of tension or anxiety. You can also experience personality changes, which could be suspiciousness. You kind of develop this suspicious feeling of people around you or things that are happening around you. It can also raise aggression levels. For physical disturbances, it could be headache, fatigue, sleeping disorders, vertigo or dizziness. You can also experience insomnia or a reduced tolerance to previous medications. And this last one is for more severe traumatic brain injuries, and it would be neurological symptoms and signs, which again could be seizures, visual disturbances, cranial nerve deficits. And again, this is more for severe traumatic brain injuries. So these are some functional consequences of both mild neurocognitive disorders due to a TBI and major neurocognitive disorders due to a TBI. So for mild, you may have a reduced cognitive efficiency, which means you would have difficulty maybe learning, problem solving, or listening to instructional goals. You may also have difficulty concentrating and a lessened ability to perform tasks. Now, these tasks could be simple or hard, but you just won't have the ability to actually perform them. So for major neurocognitive disorder, you may have difficulty in independent living or difficulty in self-care, which, they kind of go hand in hand. So you may have difficulty, living on your own, doing tasks that are part of our daily living. You may also have severe incoordination and ataxia, which would be, a lack of voluntary coordination of muscle movements. So you may stumble over things. You may trip over things that aren't actually on the ground. You may reach out for something and try to grab it and just completely miss it. You may also experience motor slowing, which would be the slowing of physical or emotional reactions. So you may have delayed speech or delayed reactions to something that somebody's telling you. And lastly, you could have a loss of emotional control. So your emotions aren't really going along with how they should be. You may have outbursts of crying, angerness, depression, and it just doesn't entirely make sense with the situation you're in. So that is my presentation. I hope you all enjoyed. Good night.